All right, there we go. All right, so today we're doing alternate nostril breathing. This is always open to like discussion. I want you guys to know, like, Stephen knows this, but if you're like, I don't understand this or this, like, just come in at any time. It's not like a formal teaching, you know, we're not like in a seminar. So alternate nostril breathing is what we're going to talk about today. You guys know me. I'm Rachel Reinhardt Taylor. I have an MD, as you guys already know. Okay, I always just introduce myself. So I think both of you know I'm board certified in family medicine, so I have an MD and board certified. I'm also certified in functional medicine, which is not what this course is about. I'm just letting you know. And then I really emphasize mind body medicine, which is you know, what we can do before. Well, let me show you. Are you still there, David? Can you still? Okay, cool. So what is mind body medicine? So this is mental and emotional well-being with physical health. And I always look for like deliverables, for example, like increased recovery, like these sorts of things that would be specific for athletes. So we use like meditation, yoga, breath work, other relaxation. There's even things I've written articles on, laugh therapy or dance therapy or things like this that help with recovery and performance. And even some of those help with blood sugar control. So okay, so let's talk about alternate nostril breathing. So this is a typical, so there's a lot of like breathing techniques that we use that we've just westernized. I always like to give credit to the people who came up with this. So in India, a long time ago, they came up with all of these different breathing practices. So you guys do like box breathing and stuff like that. This all comes from India and under the blanket of pranayama. So I want you guys to just know that. And then obviously relaxation, mental clarity, and overall well-being is helped by these. Okay, so here's the science behind alternate nostril breathing. And this is one of my favorite things is to look at the science. So are you guys familiar with the sympathetic and parasympathetic nervous systems?
A little bit. I've definitely heard of those before.
Okay, so the parasympathetic is relax, rest, and digest. And the sympathetic is when we're like really worked up and out of our heart rate variability, like we've talked about, Stephen. So in alternate nostril breathing, it's going to balance those nervous systems. You'll get relaxed. It will reduce stress. Then these are kind of more the athlete deliverables. So increase oxygenation. So this increases lung function, improved oxygen intake, and breathing out the carbon dioxide, which is very important for athletic performance. And this is something even you could do right before you start. I've had someone do it like mid-game, as we're talking about, Steven, some of these like reset things to do. It helps with brainwaves. So I think we've talked about the alpha brainwave. This is more of that brainwave when we're in a flow state. This is like the brainwave when people are like in the shower washing their hair and they're like, ding, like have good ideas. You know how people say like shower ideas. I don't know if you've ever heard of that, but people get into these alpha brainwaves more easily, and it also helps with focus. And then stress hormone reduction. Are you familiar with cortisol?
Is that what they put in your body, like if you injure, or is that
Well, so
cortisone? I don't know. That might be.
cortisone is a mimicker of this. However, cortisol, it's what your body secretes when you're stressed out. And we use that to measure stress levels all the time. And high cortisol levels constantly lead to like diabetes. It also can lead to like adrenal burnout, which is very common for athletes. And then just the cortisol level is a great way we use as an actual measure of stress levels and even how hard you're working your body. And if we're in a zone where it's like, oh, this is getting too high, there's too much stress, you're going to have muscle breakdown. And these are the things we look
Yeah.
for, it, you know, in elite athletes, especially, is avoiding this muscle breakdown, which then in turn hurts your body from overtraining. Okay. I always like to show studies because I am a doctor and a scientist. So I got to back up what I'm saying. So this is one study. So this is in 2021. They did alternate nostril breathing and their endurance increased by 15%. So it already show that we are going to have an increase in endurance when we practice alternate nostril breathing. And this is the body part of the mind body medicine, is our bodies are going to do a good job or improve. They also have a 30% reduction in anxiety. And of course, as you can imagine, this increases focus. This also helps with heart rate variability. And then at this bottom part, you can see it boosts physical performance, but also helps with emotional regulation. So this is a great example of like mind-body medicine, where we're going to get oxygenation, lower cortisol levels, better endurance, also improving the emotional aspect of it. Okay, this is the second study showing the respiratory efficiency and endurance again. So this one has a 15% improvement in respiratory efficiency. So we're taking in more oxygen, we're breathing out more carbon dioxide. This exchange brings more oxygen to the cells and the muscles and decreases muscle breakdown, in addition to like our cognition and focus and flow and things like that. So the participants in this, they reported the enhanced endurance levels and reduced perceived exertion during high intensity workouts. So essentially, these athletes increased endurance and reduced how much they feel like they're exerting themselves. So it's a win-win, right? If you're like, oh, I don't feel like this is so hard after all, you know, and then your endurance goes up and you have more in the tank when you're competing.
Okay.
This also, again, like I just said, it improves stamina during competition. So who doesn't want that extra edge, right? To have more endurance and stamina, just from the breathing technique. So, and then we have a third study that shows that it helps with, so 60 athletes. Oh no, what did I do? 60 athletes did it over an 8-week period. Again, this showed perceived stress levels were reduced. And in this particular study, it was measured via cortisol. So this tells us that for sure in the blood, this has reduced stress levels by a blood measure, in addition to these questionnaires that are subjective, you know, that are like the self-reported before and after. And then again, like here's another great thing, improved recovery times. So now we have increased endurance, decreased or increased stamina, decreased like exertion levels, improved oxygenation, and improved recovery time. So this is you know, such a huge help to all athletes. All right, so now we're going to practice alternate nostril breathing. I don't know in the car there if you can practice, but at least you're not driving, so I think we'll be okay. So David, have you ever heard of alternate nostril breathing?
I have not. This is the first time I've been trying since I've heard the word alternate nostril breathing. I'm trying to breathe out of different nostrils.
only when he started cocaine.
Yeah.
Only when he what?
Too, I ain't gonna lie.
I'm kidding. I said only when he snorted cocaine.
Oh my God.
Yeah.
Well, I mean, if you want a good way to increase endurance, there's one way, right?
Right.
Snorting cocaine. Okay. So with this,
quick twitch.
What's that?
It's my quick twitch.
Yeah, there you go. You got that fast twitch. All right. So you're gonna do, it's kind of a weird hand position. So if you can't do that, that's okay. But essentially you lower the first 2 fingers. You keep the last 2 fingers together. And yeah, it's kind of hard to do. So take your hand and your pointer and your middle finger come down and you keep those out. Yeah, kind of. Or you could just do this little shaka, the hang loose sign. That's also fine. You guys can do this today. You got it. Okay. So whatever you can do, perfect. So you put just the basics. Let me explain before we start. So you're gonna put your thumb on, you're gonna breathe in, and then you switch and breathe out. And one thing that's very important about alternate nostril breathing is that when you switch, it's always when your breath is all the way in. People want to breathe out and then switch. That's not how it works. So what you'll do is, let's do one all together. So put your finger over one nostril. So you're going to switch like this. So whichever nostril you want to start with is fine. Yeah, there you go. You good? Everyone's good? Okay, so breathe in deeply. Then hold it and switch. And breathe out. Good. Do it again. Hold this nostril and breathe in. Nope, don't go back to the other one yet. Yeah. So breathe in. Hold it and switch. Breathe out. Now stay where you're at. Breathe in again. Hold it and switch. Breathe out. Breathe in again. Hold and switch. Breathe out. So usually I do like a check-in before and after. Could you guys feel, I know I didn't tell you to focus on your bodies, but is there any change just in that short amount of time? You don't have to say yes. If it's a no, that's also okay.
I felt a little bit of relief in my chest. I'll say that. Like I felt like my chest opened up a little more than it normally did.
Okay. I can't hear you.
I'm feeling a lot of sensation like in my head. Like
Is that good?
it's like
Is that a good thing
tingling.
or a bad thing?
It's different. No, it's good.
Do you feel like that would be, well, okay, so we've only done like you know, of course, 4 breaths or whatever we just did, 4
Yeah.
cycles. This is meant to be 10 to 20 minutes. It does show, the great thing about this, as opposed to like a meditation, for example, meditation's an everyday practice, and then you start reaping the benefits. This can be done one time, like a 10-minute session, and it shows to have the same benefit. Especially, they did a study where they looked, a lot of times when people focus, they hold their breath and their blood pressure goes up. When people do a deep belly breathe to calm down, it actually creates someone to be sleepy. So the good thing about this one is it's made to cause you to be calm, but focused and alert.
Yeah.
So this is something like if you're nervous before a game or in a practice, I mean, whatever, halftime, who knows, whatever, you can do this alternate nostril breathing as a quick reset, which also won't make you like sleepy. You'll still be focused.
Well, it's interesting you brought that up about belly breathing. I had always noticed that when people, when they were trying to get me to do belly breathing or to do some yoga or not yoga, but some meditation, I'd always get sleepy. I'm like, this isn't helpful
Yeah.
to try to perform.
What was the last thing you said?
I was just saying this isn't helpful to try to perform.
Yeah. Yeah. I noticed that. And even when you know, I'm not an athlete, but when I'm trying to do doctor stuff, same kind of thing. I can't be sleepy. I want to be focused, but I don't want to be sleepy. So anyway, I know that was super quick. I want to be mindful of your time. I was going to do like a full like 15 to 20 minute of the breathing, but I think you guys got it. Do you guys feel like you want to do a full thing, or are you okay with where you're at right now?
I'm good where I'm at because you know I meditate like twice a day now. But I do have a question.
I make it.
Yeah, but I do have a question. Like, should I like do this like 10 minutes every day or 10 minutes every other day? Like, should I structure it?
So this one's really good because unlike the meditations we do, you don't have to do it every day. And so
Yeah.
this would be, I would recommend you keep with the other breath work I taught you. But this
Okay.
is a good tool for your pocket if you're like, I can't, even if you're meditating, you're like, I can't focus, my head's all over the place. The body part of the mind body medicine in this case is we're in our bodies. We're just going to do the breathing
Okay.
in our bodies. We don't have to change
Yeah.
our thinking. We don't even have to waste that energy trying to change our thinking because
Yeah.
our body will do this and our mind will follow.
Okay.
But
Okay.
you
I
can
got
do
you. I got
this if you're like, oh, before a game, or, you know, or also as we talked about, you know, making sure you practice this. So when you're in the game, you're like, this tool really helps me. So if you want to practice a few times, see how it feels. And then when you're playing or halftime, or, you know, if you can't get your head out of the, you know, anxiety zone or whatever, you know, this is a great, or if you're like, I need better recovery time, I need longer endurance, I need more stamina, this literally will help with that. Are you talking, Stephen? I can't hear you.
I said, yeah, for sure. I got you. Like, I know what you're trying to say. So.
Yeah.
David out here trying it again. He's trying it again. I seen it.
I tried to get. I'll definitely be trying this. I'll try this later for sure. How long is the effect supposed to last? So let's say you got a game and you got somebody in training and they're cool, but locks them in. How often? Like I know I kind of asked how often should you do it in general, but how often can you do it without like overdoing it, or how long is this? Ideally, how long is that ideally supposed to last?
How long? What was the last thing? How long is what?
How long is
Oh,
the feeling supposed to last? Basically, I guess that's summarizing up my question: is how long does this help lock you in before you should need to do it again?
that's a great question. And as you can imagine, depends on people's levels of anxiety. With Steven, I talk to him several times a week and we do a lot of meditation and things like that. So in Steven's case, I would imagine, he'll do 10 to 15 minutes, an hour before the game and he'll still be locked in. But at the same time, if someone's super anxious, they could do it as long as they want, which is the beauty of breath work. You can do it. You can do 2 minutes, 2 rounds of it in the bathroom if you're nervous, like while you pee. You know what I mean? So that's one thing I really love is to have, so you can have some tools that can be used whenever and automatically create a change right away. I wish I had a better time frame though for you because I am, like I said, I'm a scientist too. And so I like to be like, it's this amount of time, but unfortunately for this one, I don't have a specific time. I'd say, it can last an hour, it can last 2 hours. It just depends on the person, depends on the pressure of the situation, all of these different variables. But the good news is anyone can do it and it will only benefit. There's no harm.
I mean, it makes a lot of sense though too. Is how far you are in your practice as well, and under.
Oh no. You froze. Is he frozen for you, Steven?
Yeah, he frozen too, so he might be going through a bad stretch.
Oh, okay. All right. Well, let's wait a second and see if he unfreezes. Do you have any questions in the meantime, Steven? Oh, I can't hear you now. Your phone is muted.
Oh, no, I said I liked it and I like that like I can do it without like having to specifically be laying down with my eyes closed. Like I can just do it and laying on the couch, Like
Yeah.
it's something gives me something else.
I like that too. I like that it's an active motion because same with me, like if I'm all in my head and I'm like, okay, just refocus your mind, like that's not gonna work. So this is
Yeah.
this is one tool I reach for a lot.
No, exactly, because sometimes you can't lay down and like be like, oh, let's focus on the breath and like your mind is everywhere. So
Yeah. Yeah. And then I mean for me, and I think for some of the athletes, knowing the benefits of it is more motivation. You know what I mean? Like, oh, I gotta work on my endurance.
hmm that's true. I was thinking, I was like, I can get in better shape just by doing this, laying down. I'm
It's
like, yeah, I'll do it.
crazy. It's so crazy to me, all these tools that exist that science shows that people don't use or they just don't know about it, truthfully. I think it's
Yeah,
not knowing.
I feel like they just don't know about the actual science behind it.
Exactly. David, are you back?
You might have to text me to go in
Yes,
and
I
out.
am back. My Did you hear me? My phone overheated.
Oh, no, I didn't hear the end of what you were saying, but you were moving your hands and I was like, he's really excited. I'm into this. And then you cut off. So it was a bummer.
Yeah, phone overheated when you're driving in 115 degrees
I bet. Oh my
and it's
gosh.
sitting on the dash.
That's
Yeah.
true.
That's fun.
So what do you remember what you were saying?
No, I think I'd said it. I think I got it across. It's just um no, I don't. No, nothing of consequence. It's great. It's really interesting.
Yeah, so hopefully you can see it's hard for me to describe mind-body medicine without just demonstrating, like, here's the body effects, here's the mind, but mostly I focus on the body and the science of what this can do, and your mind will follow.
Without a doubt. Now, how do you work this in? Ideally, do you just as far as athletes, you just work it in their schedule when needed, or do you want players and athletes to have this on a scheduled thing?
I'm sorry, I'm only hearing part of your question. Can you repeat it again?
Yes, I'm sorry. Do you schedule this for athletes to do, or is this like when needed?
Do you mean alternate nostril breathing, or do you mean me to teach?
Yes. Alternate.
So if I were to example have an athlete that doesn't do any meditation or anything like this, a lot of the studies show 15 minutes per day or 2 10-minute sessions per day. So if there's not an already kind of like mind body program going, then that's what I recommend. That's what the studies show. But even one
So like for
10-minute,
Steven, it would be more when needed.
yeah, Steven and I work on it. Yeah, exactly. Or like if he's really struggling to stay, well, Steven, you speak to it, how you would use this or what kind of things we do.
I mean, honestly, I think for me, it's become at least like a 20-minute thing a day. Because I do feel the difference. Like, I just went and played professional for the first time in the DR before I go sign in Europe. And I had a first year of like struggles and challenges. And I feel like for the first time ever, I would say, in my career, like I could have such a bad start to a game and a coach can set me on the bench for like 10, 15 minutes. And all I will focus on my breathing. And all of a sudden I come in and I hit like 4 threes. And I feel just way more calmer outside of like I used to have, heavy pregame anxiety, whatever. And I feel like I didn't have any anxiety. If I did, it was just a little bit. And it's all like I feel like way more confident because of like I know I'm able to control when I'm feeling the flow state and the non anxiety state. So I think like it's kind of like you can do it when necessary, but I think definitely benefits will show in general if you do it at least like once a day. Like I actually take a time out to like do it. Like I woke up this morning, I did 20 minutes on the back porch, and I'll go before I go to bed. I'll probably do 15 or 20, and I feel like my whole mindset is different. Like I'm more calm. I'm more willing to just go with what life throws at me, and instead of being like anxious about what's going to happen or what happened or what my thoughts are thinking. So it's benefits for
Did
sure.
that answer your question, David, or did you have a different? He's talking about the different meditations because he
No,
did the course. He's the one I told you his shooting was statistically significantly better, and then we just have continued to work together. So he's referring to specific types of meditation I taught him. We kind of adjust things, giving different tools until he has exactly what works for him for now, but we'll adjust. But that's what he's
yeah.
talking about. Are you asking specifically for alternate nostril breathing, or are you asking just in general what he does?
Well, I think you both kind of answered the question. I was asking more specific alternate nostril, but that's great to understand how he handles his normal breathing, the normal processes that he does, and then the alternate nostril breathing. I assume that'd be something that early on you'd want to do more often, and then later on as more as needed, or just like a game prep thing.
Yeah, and it's not all one size fits all. Like, say, for example,
Am
I'm
I
working
right
with
or no?
someone. What's that? Sorry, did you say something?
I didn't say that.
Oh, okay.
No.
So, for example, if I teach this course or whatever, I'm working with an athlete, and they're like, Stephen does certain meditations that improve heart rate variability. I think you know about heart rate variability, right, David? It's like the sexy topic right now amongst all the athletes. So his specific type of meditation is to improve heart rate variability. And comes with all sorts of physical benefits. So that's what he does. If there's a person that's like, that doesn't work for me, then we use something else. Like alternate nostril breathing may be the thing that athlete X needs, you know, for them to do daily. So it really depends on the person. If you are just anyone in general, 15 minutes a day or 10 minutes twice daily is what the actual research, what they did. But there's also the studies that show just one 10 to 15 minute session shows as much benefit. So this one I really like as like a in your back pocket if I need it, or even a daily exercise. So
Perfect.
any other questions?
No, I'm good on my side. You know, I'm gonna do my work.
I like make him. I'm like, you're doing this now. How are you feeling? More of this.
It's true though, for real.
So, okay. And then we also do sometimes we were doing pregame guided meditations, but you're doing well without those now, Stephen, right? Or you're still, do you need
Yeah,
them?
yeah, definitely. I mean, I still do like my own. Like, I like when we started doing it, definitely ran with it and did it on myself. But I think like the pregame guided meditation to start, especially because I was new to the pro field and all that. And now when I get a hang of it, like everything's on my time. It's a routine. Definitely like helped a lot. Like even like on gamers, I feel like I was meditating like 2 times 20 minutes and then maybe 10 minutes right before I went to the game, you know? So it's
Yeah,
definitely like really beneficial. Like I feel like really good in my body, mind, and all that. So
yeah. So we did, David. I don't know if you want to know exactly what I was doing with Stephen or the other athlete I work with. We just did the 4-week course just to have a basics, and now I just work with him on his own. So it just depends. Like also like there's other people I've worked with who just like I'm not gonna run after them. You know, they have to want to do it. So that's like if someone wants to continue, they can. So that's all it is. Just I like doing these kinds of exercises, and then like when he was having a tough time before games, we did guided meditations. But now he doesn't need me before games, so
hmm
I guess I did my job well
Good.
since he
That's the
doesn't
whole
need
idea, right?
me.
yeah, yeah,
Yeah,
that's the
that's you're doing a good job.
I know. It's
stuff.
bad. It's bad for business. All right.
Yeah.
Any
No,
other
this is wonderful.
questions?
Thank you for letting me be a part of it.
Of course. I tried to be quick. I try to not draw it out, you know, but I'm always here if people want to practice, if people want to whatever, I'm always happy to teach because I really love teaching this.
And then let me know if you want any more reference or opinion, David. I'm always here to talk about it because I know as an athlete, sometimes you're skeptical about doing new things, about your routine, and you've done things a certain way for so long, so you're scared to change it. But if you ever need reference or want to talk about it, I'm always here. So
Well, this is wonderful. And again, thank you for letting me even be a part of your session and jumping in there. So thank you.
No
for
worries.
sure, no
Thanks for
problem.
coming, David.
Of course, this is great. And yeah, let's talk about next one. I'd love to consider on some more.
You'd like to what?
Or,
Mm.
or there's a little spot where we miss each other. Let me text you. I'll just text you. It'll be simplest.
Yeah, I was hoping because I was like, just come to this. It's easier to understand. Like if you just come see it.
Yes, this is perfect. And I would love to sit on more of them, but I'll text you.
Okay, yes. If you would like to just, yeah, because I missed part of what you just said. So if you want to send a voice memo or text, please go ahead. I'll be here. I'll have my phone.
Okay, thank you.
And we're going to have to talk about your boundaries and self-care. About overextending yourself, I mean.
Okay. Yes. Well, yes. Yes.
Just kidding. All right. Have a good day,
No,
you guys. Thanks for joining me.
absolutely. Thank you.
Bye,
Thank you.
Steven. Let me know
Bye
how things
bye.
go, Steven.
Sounds good. I'll let you know. I'll keep you updated throughout the week.
Okay, bye.
Bye bye. See ya.